Welcome to our YouTube channel. Today, we're discussing home care for pacemakers and ICDs. So, don't forget to like, share, and subscribe to our channel and stay with us till the end. So, after the permanent device insertion, how long is the patient's hospital stay typically?
Well, the patient's hospital stay may be just 1 day or less, and follow-up in an outpatient clinic, office, or device clinic is common.
That's quite quick, but I can imagine that the patient might feel anxious or vulnerable after the procedure. How do you handle that?
Absolutely. The patient's anxiety and feelings of vulnerability may interfere with their ability to learn the information we provide. So we include caregivers in the education and provide printed materials for use by the patient and caregiver. We establish priorities for learning with the patient and caregiver. Education may include the importance of periodic device monitoring, promoting safety, surgical site care, and avoiding EMI.
That sounds comprehensive. What about activities? Are there any restrictions?
Yes, the educational plan should include information about activities that are safe and those that may be dangerous. We discuss with the patient and family what they have to do when a shock is delivered. We may also facilitate CPR training for the family.
That's really important. And what about informing the healthcare team about the existence of an implanted pacemaker or ICD in the patient's body?
Yes, that's crucial. Informing the healthcare team about the existence of an implanted pacemaker or ICD in the patient's body is necessary in order to prevent using external synchronized or defibrillation shocks provided by a DC shock device.
Got it. And at the completion of education, what should the patient and caregiver be able to do?
They should be able to state the impact of device implantation on physiologic functioning, ADLS or IADLS, self-image and roles, relationships, and spirituality. They should understand the changes in lifestyle necessary to maintain health and know the name, dose, side effects, frequency, and schedule for all medications. For patients with pacemakers, they should check pulse daily and report immediately any sudden slowing or increasing of the pulse rate. This may indicate pacemaker malfunction.
That's a lot to remember. What about infection prevention at the insertion site of the device?
Yes, they should leave the incision uncovered and observe it daily for redness, increased swelling, and heat. They should take their temperature at the same time each day and report any increase. They should avoid wearing tight, restrictive clothing that may cause friction over the insertion site, and initially avoid soaking in tub and using lotion, creams, or powders in the area of the device.
And what about activity restrictions?
They should restrict movement of the arm until the incision heals. Do not raise the arm above the head for 2 weeks. They should avoid heavy lifting for a few weeks and discuss the safety of activities, for example, driving, with a primary provider. They should recognize that although it may take up to 2 or 3 weeks to resume normal activities, physical activity does not usually have to be curtailed, with the exception of contact sports.
What about electromagnetic interference?
They should understand the importance of avoiding large magnetic fields such as those created by magnetic resonance imaging, large motors, arc welding, and electrical substations. Magnetic fields may deactivate the device, negating its effect on a dysarrhythmia. And at security gates, at airports, government buildings, or other secured areas, they should show their identification card and request a hand search, not a handled device search. They should obtain and carry a letter from the primary provider about this requirement. Some electrical and small motor devices, as well as products that contain magnets, for example cellular phone, may interfere with the function of the cardiac device if the electrical device is placed very close to it. They should avoid leaning directly over large electrical devices or motors, or ensure that contact is of a brief duration. Place cellular phone on the opposite side of the cardiac device. Household appliances, for example microwave ovens, should not cause any concern.
And finally, what precautions and safety measures should they use?
They should be able to describe what to do if symptoms occur and notify the primary provider if any discharges seems unusual.
That's a lot of information to take in. Could you also talk about the importance of maintaining a log for the ICD discharges?
Absolutely. It's important to maintain a log that records discharges of an implantable cardioverter defibrillator. Record events that precipitate the sensation of shock. This provides important data for the primary provider to use in readjusting the medical regimen.
And what about family members? How can they help?
We encourage family members to attend the cardiopulmonary resuscitation class. It's also important to call 911 for emergency assistance if a feeling of dizziness occurs.
What about medical identification?
Yes, the patient should wear medical identification that includes primary provider information. They should carry medical identification with the primary provider's name, type and model number of the device, manufacturer's name, and hospital where the device was inserted.
And what about the shocks from an ICD? Can they harm others?
No, they should avoid frightening family or friends with unexpected shocks from an ICD, which will not harm them. Inform family and friends that in the event they are in contact with the patient when a shock is delivered, they may also feel the shock. It is especially important to warn sexual partners that this may occur.
What about community resources and follow-up care?
They should identify community resources for peer and caregiver or family support. Adhere to appointments for follow-up care that are scheduled to monitor the electronic performance of the cardiac device. This is especially important during the first month after implantation and near the end of the battery life. Remember to take the log of ICD discharges to review with the primary provider.
And finally, what about health promotion? Disease prevention and screening activities.
Well, they should identify the need for health promotion, disease prevention, and screening activities. It's all about maintaining a healthy lifestyle while managing the device.
That's a lot of valuable information. Thank you for sharing your expertise with us today.
You're welcome. I'm glad I could provide some insight. Remember, it's important to stay informed and proactive when it comes to managing pacemakers and ICDs. Stay healthy, stay informed.